Insomnia. Imagine you go to bed feeling physically tired, expecting sleep to start naturally. However, even after lying in bed for a long time, sleep does not begin easily. This condition is known as insomnia, one of the most common sleep disorders. With insomnia, you may experience difficulty initiating sleep, maintaining sleep throughout the night, or returning to sleep after early awakenings. As a result, the overall sleep quality becomes fragmented and non-restorative. Sleep is normally regulated by a complex interaction between the brain's sleep-promoting systems and its arousal networks. During nighttime, sleep-promoting signals gradually increase while alertness decreases. In insomnia, this regulatory balance becomes disrupted. The brain's arousal system remains relatively overactive. Sleep apnea. Imagine you fall asleep normally, but during the night your breathing repeatedly slows down or briefly stops without you being aware of it. This condition is known as sleep apnea. Sleep apnea is a disorder in which breathing becomes interrupted multiple times during sleep. The most common form, obstructive sleep apnea, occurs when the muscles of the throat relax excessively. This relaxation temporarily narrows or blocks the upper airway, reducing the flow of air into the lungs. When this happens, the oxygen level in your blood can begin to decrease. In response, the brain quickly activates a brief arousal response to reopen the airway and restore normal breathing. Narcolepsy. Imagine you are awake during the day, talking, studying, or working, when a sudden and overwhelming urge to sleep appears. Your eyes become heavy, and within moments you may fall asleep unintentionally. This condition is known as narcolepsy. Narcolepsy is a neurological sleep disorder that affects the brain's sleep-wake regulation system. In a healthy sleep cycle, the brain carefully controls when you remain awake and when different sleep stages occur. In narcolepsy, this regulation becomes unstable, allowing sleep processes to intrude into normal waking periods. This disruption is often linked to reduced activity of hypocretin neurons, which normally help maintain wakefulness and stabilize the sleep cycle. Restless leg syndrome, RLS. Imagine you lie down at night to sleep, but you start feeling an uncomfortable sensation deep inside your legs. The feeling may resemble tingling, crawling, or pulling, and it creates a strong urge to move your legs. This condition is known as restless leg syndrome, RLS. Restless leg syndrome is a neurological sleep-related disorder that primarily affects the sensorimotor system. The symptoms usually become more noticeable during periods of rest, especially in the evening or at night when the body is preparing for sleep. Research suggests that RLS is associated with dysfunction in dopamine signaling pathways within the brain. Dopamine plays an important role in controlling movement and sensory processing. Sleepwalking. Imagine your body getting up and walking while you are still in a sleep state, without having conscious awareness of your actions. This phenomenon is called sleepwalking. Sleepwalking is classified as a non-rapid eye movement, NREM parasomnia, meaning it usually occurs during the deeper stages of sleep rather than during dream-rich REM sleep. During sleepwalking episodes, parts of the brain responsible for movement may become active, while the regions responsible for conscious awareness remain in a suppressed state. In this condition, the normal transition between sleep stages becomes unstable. The motor control networks may activate without full cortical arousal, allowing a person to perform simple or even complex movements while remaining partially asleep. Night terrors. Imagine waking up suddenly in the middle of the night with intense fear, screaming, or panic, but having little or no memory of it the next morning. This phenomenon is known as night terrors, a type of parasomnia. Night terrors typically occur during deep non-REM sleep, often within the first few hours after falling asleep. Unlike nightmares, which happen during REM sleep and are remembered, night terrors involve sudden activation of the autonomic nervous system, causing rapid heart rate, sweating, and extreme agitation. During a night terror, the brain's arousal systems briefly surge while the individual remains largely asleep. The body reacts as if facing real danger, even though the person is still in a deep sleep stage. REM sleep behavior disorder. Imagine your body acting out your dreams while you are still asleep, You might move, talk, or even make sudden physical actions corresponding to your dream content. This condition is known as REM sleep behavior disorder. Normally during rapid eye movement REM sleep, the brain is highly active because dreaming occurs, but the body is kept in a state of muscle atonia, which means temporary paralysis of most skeletal muscles. In REM sleep behavior disorder, this muscle paralysis mechanism becomes impaired. The neural circuits responsible for inhibiting motor activity during REM sleep fail to function properly. As a result, the person may unintentionally perform movements that reflect the dream scenario. Circadian rhythm disorder. Imagine feeling wide awake at night when you should be sleeping, and extremely sleepy during daytime when you are expected to stay alert. This mismatch between your internal body clock and the external environment is called circadian rhythm disorder. Your body follows an internal biological timing system known as the circadian clock, which is mainly regulated by the brain's suprachiasmatic nucleus. This structure synchronizes physiological processes such as hormone release, body temperature, and sleep-wake cycles with a 24-hour day-night pattern. In circadian rhythm disorder, this synchronization becomes disturbed. Factors like irregular light exposure, shift work, or rapid travel across time zones can shift the internal clock out of alignment. Sleep paralysis. Imagine waking up but being unable to move your body or speak, even though you are fully conscious of your surroundings. This temporary inability to move is called sleep paralysis. Sleep paralysis usually occurs during the transition between REM sleep and wakefulness. During REM sleep, your brain naturally induces muscle atonia, a protective state that prevents physical movement while you are dreaming. In sleep paralysis, this muscle inhibition continues briefly even after consciousness begins to return. Because the brain is awake while the body is still under REM-related motor suppression, you may feel trapped or unable to respond. Some people also experience hallucination-like sensations due to partial activation of dream-related neural networks during this transitional state. Bruxism. Imagine grinding or clenching your teeth unconsciously while you sleep. This condition is known as sleep bruxism, a common sleep-related movement disorder. Bruxism typically occurs during non-REM sleep and involves repeated activation of the jaw muscles. It is often linked to heightened central nervous system arousal during sleep, stress, or misalignment of teeth. During episodes, the brain sends signals that trigger rhythmic contraction of the masticatory muscles, causing teeth grinding or jaw clenching. Over time, this can lead to tooth wear, jaw discomfort, and disrupted sleep. Hypersomnia. Imagine sleeping for longer hours than usual, but still feeling excessively sleepy during the daytime. This condition is called hypersomnia, a disorder characterized by abnormal prolongation of sleep duration or persistent sleepiness despite adequate rest. Hypersomnia is associated with dysfunction in the brain's wake-promoting neural systems, which help maintain alertness during daytime. When the regulatory mechanisms that sustain wakefulness become less active, the body may remain in a state of excessive sleep drive. People with hypersomnia may sleep for extended periods at night and still experience difficulty staying fully alert during daytime activities. Periodic limb movement disorder. Imagine your legs making repeated, involuntary jerking or twitching movements during sleep without your conscious control. This condition is known as periodic limb movement disorder, PLMD. PLMD is a sleep-related movement disorder characterized by stereotyped, repetitive muscle movements, most commonly in the lower limbs. These movements usually occur during non-REM sleep and can happen every few seconds to minutes in clusters throughout the night. The exact cause is not completely understood, but PLMD is thought to involve abnormalities in central nervous system motor regulation and possible disruptions in neurotransmitter signaling pathways that control muscle activity.